Back. My next guest is Miss Erin Gatewood and Miss Laura Williams, who are physical therapists with KORT Physical Therapy. And you guys have a, well, to me is kind of a new, interesting way that you help cancer patients with rehab and lifestyle. Laura, tell me a little bit about the program.
Absolutely. So we started this program, one, because we saw a need in that patient population. There are many symptoms that are related to cancer treatment. So from the point of diagnosis through treatment, which may be chemo, which may be radiation, and then after, we really saw that evidence showed that exercise, lymphedema management and prevention can really benefit overall quality of life, as well as address some other common symptoms such as cancer-related fatigue, pain, and we really saw that, hey, that's a need, that's a population that doesn't have a specific program, and we want to be able to give them that individualized treatment that they need.
Erin, she mentioned fatigue, and that's a big thing we see with cancer patients. They're just worn out. How does physical therapy help that?
So we do a lot of exercise, obviously, which can help people get back on their feet when maybe for months they haven't been able to live their normal routine and normal life. So some of the fatigue is related to some of the cancer-related treatments themselves, but some of it is also just lack of being able to live and do their normal. So we jump in there and we can really help them with, you know, being able to move again and not being as tired when they move.
Well, because it's not like maybe running on a treadmill or lifting 100-pound weights. It specifically develops as somebody who is really fatigued from cancer.
Mm-hmm. Yeah, it's a lot more, you know, we start off slow, just like anything else, and the patients are very comfortable with it. You know, it's always really what will best serve them. Like, what need do you have, and how can we help exactly, you know, what that is. Just talk to us. That's kind of the conversations that we have.
Now, there's other things that you treat too, and Laura, you mentioned lymphedema. That's basically swelling, and it can be swelling of an arm or a leg following a surgery for cancer. Tell me some of the treatments you do for that.
So there are a few things. One of the best, and we have at our KORT Nicholasville location, we have a therapist who is certified recently in lymphedema management. So there will be a lot of different techniques. So that can be manual lymphatic drainage, different wrapping, compression wrapping, and then also kind of progressing them to an independent kind of compression sleeve, depending on where the lymphedema is. So that would be something that once they develop lymphedema, then they would probably have to be part of their regimen continuously. But what's also kind of unique in the forefront is that it's been shown that you know, early intervention after some of these treatments can help prevent lymphedema too. So that's kind of where we want to, yes, treat it certainly when it comes, but we also want to be diligent in helping patients prevent it
before it gets there.
Absolutely.
Now, there's also some nerve pain that can be associated with cancer. Erin, is there something you do for that too?
Yeah, so nerve pain, it could be associated with just the fact that they had maybe some radiation in that area, or chemotherapy that has affected the nerves, and some of them will regenerate, as nerves sometimes do. So we really help fast forward that process and get them back as quickly as possible, because a lot of that time is really precious, because they might not have a lot of time, and they want to be able to lift their grandkids, or God forbid even their child, as it can happen at any age. So we work on you know, getting the strength back after some sort of nerve injury, or even, like Laura said, some prevention pieces that go into it, as we work on the soft tissue after, you know, a mastectomy or after surgery, and help getting those tissues moving again so they don't get nerve pain into their arm.
Now, KORT has several locations, and they can come to those locations and get the treatment that we're talking about, but you can also teach them so they can do some stuff at home.
Absolutely.
Tell me how.
Okay. And that's one of the goals kind of of physical therapy in general, is we want to, yes, help you through the process where, you know, it's the skilled intervention is needed, but we want to get you where you don't need us anymore, essentially. So with that, say, you know, I have a patient that I treated that had head and neck cancer. So for him, it was a lot of range of motion exercises, a lot of strengthening exercises, a lot of kind of retraining where he maybe lost some innervation of his musculature after the surgery. So we had to really kind of hone in on that. So for him, it was a comprehensive program that he's probably going to need to do, you know, quite a bit, but then after a while, it kind of, you go back into your normal activity. So for him, hopefully that will be some sort of exercise, what he enjoys, as well as doing what he needs to do at work and other places.
So the goal is not only treat them at the time, but get them back. Just because you have cancer doesn't mean that life stops. It goes on, and you guys are helping people get the strength, the stamina, to go on and live life.
And we can really, you know, it's another person to talk to and be able to have someone walk you through this terrible process and answer questions like, is this normal? You know, is this supposed to happen to me? And we can say, yeah, you're good. Or we might say, hey, like, let's get you some care that you need that might not be within my realm. Like, let's send you back to the oncologist. So we are there to catch, you know, a lot of things and spend a lot of one-on-one face time with these patients. And I think that, you know, it just helps them to feel more confident and comfortable.
That's great information.